Hey there, and welcome. If you or someone you care about is struggling with that nagging, mysterious pain, numbness, or weakness in your neck, shoulder, or arm, then you are in the right place. Today, we're going to pull back the curtain on a really powerful diagnostic tool, the MRI of the brachial plexus and thoracic outlet. Okay, let's get into it. So, right off the bat, let me ask you something. Did you have any idea just how vital an MRI is for this specific part of your body? We're not talking about just any old scan here. This is a super specialized look at what is essentially a delicate, complex highway of nerves that controls, well, your entire arm. And why is it so complex? Well, because we're looking at the brachial plexus and the thoracic outlet. These aren't just vague anatomical terms. They're critical junctions. Picture a busy intersection where nerves, blood vessels, and muscles are all packed in super tight. It makes the whole area really vulnerable to getting squeezed, pinched, or injured. So to help us navigate all this, here's our game plan. We're going to cover what this exam is and why it's such a big deal. We'll talk about when a doctor might recommend one, what actually happens when you're in the machine, and of course, what it can find. And we'll wrap up with why that final report is arguably the most important piece of the puzzle. All right, let's start at the beginning. What exactly is this exam, and why is it so incredibly important for getting to the bottom of what's going on? This slide really says it all, doesn't it? On one side, without this MRI, you're kind of stuck in a world of uncertainty. You might even be looking at more invasive tests down the road. But with the MRI, it's a total game changer. You get these unbelievably detailed pictures that can pinpoint the exact problem, whether it's inflammation, a nerve getting compressed, or even a tumor. And this is huge. It's a completely non-invasive way to get answers with absolutely zero radiation. Okay, so that leads us to the next logical question you're probably asking. When would my doctor actually tell me I need to get one of these? Your doctor isn't just taking a shot in the dark. They have very specific reasons for ordering this scan. They might suspect something like thoracic outlet syndrome, where things are getting squeezed in that tight space we talked about. Or maybe you've had an accident and they need to check for nerve damage. It's also the go-to tool for spotting inflammatory issues, checking for tumors, or even just creating a detailed map before tricky surgery. And here is the absolute bottom line. Timing is everything. Getting this exam done early, as soon as the symptoms start pointing to a problem, massively increases the odds of finding a treatment that works before there's a chance for any long-term damage. So you get why you need it. But what's it actually like? Let's walk through the procedure, because honestly, just knowing what's coming can make a world of difference and take a lot of the anxiety out of it. You might be surprised to hear that the success of the whole scan really hinges on careful planning. First things first, the technologist's number one job is to get you comfortable and to help you stay as still as possible, because any movement can blur the images. Next, they'll place special equipment called high-resolution coils around your neck and shoulder. Think of them like super-powered antennas, designed to kick up the tiniest details. And finally, the scan itself is carefully mapped out from multiple angles to build a complete, three-dimensional picture of everything in there. Now, during the scan, the MRI runs different sequences, and each one has a special job. It's like a team of detectives working together. The T1 and T2 sequences, for instance, are brilliant at telling different tissues apart, like telling nerve from muscle. Then you have the STIR sequence, which is an expert at spotting any inflammation or swelling. And if your doctor suspects a tumor or an infection, they might use a contrast dye to make those areas light up on the screen. Each sequence adds another piece to the puzzle, and together they create a crystal clear picture of what's going on. Okay, so we've covered the how. Now let's get to the part that really matters to you as a patient. What can this incredible scan actually find? This is really where the magic happens. This MRI can spot a whole range of problems with amazing accuracy. We're talking about things like neuritis, which is just a fancy word for nerve inflammation. It can see damage from injuries, find tumors, whether they're cancerous or not, and it can nail down the diagnosis for those tricky compressive syndromes we mentioned earlier. And here's the really cool part. Each one of these conditions leaves a unique fingerprint on the images. They all have specific signs that they give off. And the MRI is specially designed to detect those subtle clues, giving a level of accuracy that other tests just can't match. So, the scan is done, the images are on the screen, but we're not finished, not by a long shot, because now comes what might be the most critical step in this entire process, the radiologist's report. This quote on the screen absolutely nails it. The images by themselves are just data. They're pictures. It's the radiologist's expert interpretation that turns those pictures into a clear roadmap for your doctor. A detailed, carefully written report is what guides the treatment plan that ultimately is going to help you feel better. So what's actually in this report? Well, it's not just a simple yes or no. It's going to describe exactly how big an injury is, where it is, and how it's affecting all the nerves, vessels, and muscles around it. And it'll point out all those key visual signs of inflammation or compression. It's basically a complete instruction manual for your doctor. And that really brings us full circle. This entire process, from the scan to that final detailed report, is all about one thing: replacing uncertainty with clarity. It gives you and your doctor a precise diagnosis, which is the essential first step. So the final question really isn't about the problem anymore. It's about the solution. With this clear answer in hand, what's the next step on your path to recovery?